Clickbait is internet content with an irresistible thumbnail or a headline that draws you right in, but then you click through and find out that the content does not in any way live up to the billing. Part of our work at Best Practice is to keep an eye out for clickbait for you. Not just because we love transparency, and we do, but clickbait wastes your time, your money, and it can even be dangerous. Here's an example from this week's headlines. This is from Eat This, Not That, a website I usually really like and is highly influential. Spoiler alert, this is clickbait. I'm presenting it to you because I want you to learn how to tell and learn for yourself when what you're reading is really clickbait. First, look at the headline. If this headline were true, it would be incredibly important. Arthritis is a painful, disabling condition that affects more and more of us as we age. As a matter of fact, there's three main categories of arthritis. Osteoarthritis, that's the most common. It's the breakdown of cartilage in our joints. Everything gets worse as you age. Second is inflammatory arthritis. This is the one you've heard of as rheumatoid arthritis. Don't forget there's also psoriatic and even ankylosing spondylitis. And third is post-traumatic. This is the arthritis you get when you're old from things you did and enjoyed when you were young. Maybe you grew up as a farm kid or had a really hard physical job, or you were a big runner, or a sports injury, maybe even as a child, etc. While we don't have strong proof, there's an increasing consensus among doctors that eating inflammatory foods makes arthritis worse, and conversely, eating anti-inflammatory foods can make arthritis pain better. And we know there are some compounds, like turmeric and ginger, which are so safe and so strongly anti-inflammatory that you should pretty much take them every day and monitor the effect on your inflammation with your blood level of C-reactive protein. Well, the way this headline of this article is written, you'd think we should put vitamin E on this list. Should we? No. Before you read any study, the first thing you do is look at the journal and where the researchers are from. The article referenced in this story is from the European Journal of Clinical Nutrition. Never heard of it. The authors are all Chinese, and I'm not familiar with any of their institutions. Look, my ignorance isn't their issue, but conversely, I can't use their good reputation to be sure they're trustworthy if I've never heard of them. The next step is to evaluate the actual science. This article is an analysis of 9 other studies that were selected by specific criteria from the Cochrane database. Ooh, Cochrane database, I've heard of that. Highly credible, known for their excellence in statistical work. Scientists know that not all information is the same. In fact, the power of any one piece of information really depends on where it falls on a pyramid of evidence. The higher, the stronger. This paper is a systematic review of prior studies. That's what they call filtered information and evidence synthesis. Our article ends up reviewing almost 50,000 subjects. That's a really good number. Overall, yeah, this seems like really good science. Well, the last step in evaluating any article is to see if the science justifies the headlines and the conclusions. Well, the number 1 in the title of this article suggests that vitamin E supplementation was compared to all the other forms or treatments of arthritis, like nonsteroidal anti-inflammatory drugs, light exercise, injections, or at least all the other commonly used supplements like glucosamine, chondroitin. Well, it wasn't at all. I mean, no. So what makes it, vitamin E, the best, the number 1? Well, in this article, absolutely nothing. The headline goes on, for preventing and treating arthritis. But the journal article I looked up that they reference only discusses rheumatoid arthritis. What if you're one of the millions of people with the much more common osteoarthritis? This article isn't even about you. Okay, so gotcha, clickbait, but why not just try vitamin E and, see if it helps? Well, first of all, vitamin E is not entirely without risk. Vitamin A, D, E, and K are all known as the fat-soluble vitamins, and therefore they actually accumulate in the body. What that means is if you take too much of them, they can become toxic. Hypervitaminosis E can cause abnormal bleeding, including in the brain, which can be actually fatal. Vitamin E can also cause and change your metabolism of other drugs that screws up something that's working for you. For what? For little or no chance at a legitimate reward. Science is a tool. It's a tool that can help us make proper and safe decisions about our health. In this case, this clickbait article is certainly not convincing. Hold off on vitamin E, or anything else for that matter, until we get to see convincing data and the science supports taking it.